All right. Good afternoon, everyone. Thanks for joining us here with VA Eastern Kansas. I'm Rudy Klopfer, the Executive Director of VA Eastern Kansas, which includes the Leavenworth Hospital, the Topeka Hospital, which I'm at today, and our clinics all across Eastern Kansas and Northwest Missouri. We welcome you to this event as we and I have some important information to be able to share with you, some national information that's coming out as an integrated healthcare system, as well as some local information. I want to share with you what our agenda is today, and so you know where we're going. We're going to talk about the AIR Commission, the Asset and Infrastructure Review, and the market assessment, which has been taking place across the nation over the past several years due to some requirements through the Mission Act. We're going to talk about our current state in Eastern Kansas and speak to what we've already have been doing and where we are today, and then the future state, some of the recommendations and complementary strategies that the Secretary is making back to the President through the Mission Act and the market assessment. And then finally, we'll answer some questions as we're able to. But if you have questions, go ahead and put them into the chat box. We're monitoring them. If we can't get to them today, we will definitely answer those if we're able to, as this is information that we're learning as well as we go forward. But then they'll be available to you to be able to look at a later date. But again, I want to thank you for joining us today. First of all, the VA is the largest integrated healthcare delivery system within the nation. We have over 1,200 sites of care. I told you what our sites of care are, those clinics, our hospitals, but that's across the nation. There are a lot of points of care to provide care to our veterans, and we work very closely with our community partners as well. This is a discussion around the AIR Commission, specifically the Asset and Infrastructure Review and the market assessment. As you would think about that, it talks about infrastructure, which are often buildings. And healthcare is provided in those buildings, but it's our people that provide the healthcare to you. And so we're focusing on our employees to be able to continue to give them the tools that they need to provide this service to you. So this is about the people, but we're going to talk about buildings and infrastructure as well today. The average age of facilities, VA facilities across the nation, is 58 years. And so as this market assessment has rolled forth, there were some challenges that VA nationally needed to look at that. One of those is those aged facilities. 58 years for a hospital is quite old. For Eastern Kansas, Leavenworth Hospital was built in 1933 and Topeka in 1958. Both older, and in Leavenworth, historic. And so that is some challenges that we face as we move supplies to the units, to the ED, to other locations. It takes some time to be able to do that, or to be able to have surgeries in a modern facility. It's difficult, so we need to be able to continue to look at our facilities. The second challenge which we had was the needs of veterans are changing. Where they live, where you live, maybe in a rural community, maybe in urban, but it's changing. We know that a lot of our veterans, even here, but a lot of veterans across the nation, go down to those warmer communities, warmer states in the wintertime, snowbirds, which we've heard. And so we need to adjust how we take care of veterans wherever they may be. And our female veteran population is increasing. We have about 12% of our population is our female veterans. And so we take care of their needs. And we have to adapt and pivot of how we do that to make sure that they're getting their needs met. And finally, healthcare is changing. When our hospitals in Eastern Kansas were built, a lot of inpatients and inpatient care was happening. That's changed now. A lot is now outpatient care. A lot is out to those clinics, community-based outpatient clinics. We're taking services out there to where you live. That's changed. Care is being brought where you live, where our veterans live. Home care, quite a bit more, and as we know, this past 2 years, virtual care. We were doing virtual care beforehand, but we've increased that during the time of the pandemic. So these three things were challenges, and the market assessment would allow that to review and to look at of how do we move forward in providing the care to our veterans at the right place, at the right time in 21st century medicine. So it came to this market assessment, which I'm going to talk about. The Mission Act of 2018, this was a requirement that the Secretary would have market assessments completed across the nation in all healthcare communities that the VA serves. And that occurred here in Vision 15, which we in Eastern Kansas is a part of. Some of the focus was to really look at the healthcare network. How are referral patterns going for different specialty services? Also to be able to work with our academic affiliates, our federal partners, Department of Defense, and other private sector healthcare organizations and providers. And we have some great relationships with our providers in our communities. And really it's the focus of hearing what our veterans expect, looking at our VA capabilities, looking at the community resources, and looking at the demographics. Where are our veterans at? Where are they moving to? And over time, as veterans may pass and die, how much more care can we provide to other veterans who are seeking care for us? And we've done some great things this year where we've increased our new unique veterans being seen in Eastern Kansas by 3.7%. It's a great campaign we had. I found one, and we've had a lot of veterans come to us, and we're excited about that. Over the past 2 to 3 years, a third-party organization was looking at a lot of data points from fiscal year 2019 and before to be able to assess the number of veterans, the type of care that we're providing, and to be determined how we move forward in providing this care to you, our veterans. I want to let you know that the veterans is the centerpiece of the care that we provide, and it always will be. That is our mission. And we have a great saying here in Eastern Kansas: every day is Veterans Day, because we serve you. These market assessments are designated to align the future of VA healthcare with the veterans' needs and expectations. So as I said, the Mission Act, based in 2018, was look at these market assessments. And what this market assessment was looking at data, looking at the data across many different databases regarding number of patients that we see, number of patients that may come into our emergency department, number of patients that may be inpatients or that may have received care in the community. A lot of those data points were given to this organization to review and then to analyze. And we were looking at a 30-minute radius for primary care and a 60-minute radius for specialty care services. And this is nationally as well. The services were involved with interviews and sharing the best practices and the challenges that we had both locally and nationally for healthcare. Eastern Kansas leaders were also involved, and our subject matter experts. And we shared challenges and positive things that we do and we provide for you, our veterans. And finally, there were opportunities for you as veterans to give input back to this third-party administrator in gathering feedback for these recommendations that are being provided by our secretary up to the president. They looked at a cost-benefit analysis as well as a cost-benefit and as well as analyzing the data in totality. The goal of this market assessment is really focusing on this high delivery network looking at accessibility and quality of care for our veterans, improving the satisfaction and experiences for you as a veteran, balancing demand and supply, and optimizing the VA resources, working within the community, working within our Department of Defense partnerships, and our academic affiliates as well. Wanted to share with you the timelines, because that's a great information that individuals want to know what's happening with this market assessment. And so, as I said, back in 2019, much of that data was being reviewed. But where we are today, on March 14th, in just a couple of weeks, VA will publish the recommendations of the Secretary for the Air Commission's consideration. The Air Commission is a bipartisan, presidential appointed and congressionally approved commission that will look at the Secretary's recommendations, and then over the next year, in 2022, which we're in, we'll gather additional feedback from you, our veterans. They'll be holding public hearings, visiting VA facilities, meeting with partners, and listening again to you as veterans. So in the near term, through these recommendations, there will not be major impact. I want to talk to you a little bit about where we stand as Eastern Kansas. We have two main hospitals with 3 to 4 CBOCs, our community clinics, that are responsible to those main hospitals. In Leavenworth, that hospital was built in 1933, and there is a lot of historic sites, buildings on that campus. It's a wonderful place. You think about all of those who have walked the halls. It's amazing to think that, and the care that we give to veterans. But it is historic, and with that comes some opportunities and funds that need to be put into the buildings to keep them ready to serve you and our healthcare needs. There is some annual review that's done on the deficiencies of the facility, our HVAC, our roofs, our piping, and for Leavenworth it costs about $200 million to resolve all of those concerns. And it's about a $21 million annually maintenance costs for those. For Topeka, it's $141 million to be able to resolve and fix those deficiencies of our facilities, and that's about an $8 million annual cost to us. That's a cost, a taxpayer cost to be able to do that one. So we are continuing to look at that and know that that is a cost to us. We are at a point that as we are in fiscal year 22, we're continuing to look at the data and to determine as we provide more care to you, that's important to be able to see what services we still need to provide to you as we move forward. I want to share with you the recommendations of the Secretary that will go to this Air Commission, in which they will start reviewing and seeking additional information. And this is at the Leavenworth campus, and this is what, again, our recommendation the Secretary is making: to convert the emergency department to an urgent care center, establish a new outpatient facility on the existing grounds of the Leavenworth campus to include primary care, outpatient specialty care, and some other critical support services, pharmacy, lab, radiology, and potentially some more as well. Modernize our domiciliary beds in Leavenworth, and to reduce the beds to 100. We've actually already moved in that direction as we were strategically planning based upon the data that we reviewed as a leadership team and as our senior leaders and the direction we felt Eastern Kansas needed to go. And so we've decreased those number of beds, but still meets the needs of our veterans and the staff that are there who are providing that. For our clinics, relocate Platte City, CBOC, to the northwest Kansas City area that is designing and developing a new larger clinic in the Northland in Missouri. Again, that's in Missouri, but part of our Eastern Kansas team. and then to relocate Wyandotte CBOC to a new location in Wyandotte County. And we have actually done that as well. I have a team right now that is getting ready to open up a new Kansas City, Kansas clinic right close to the Legends. And they anticipate that this coming next Monday, we'll be seeing patients there. We're excited for that as well. Some other complementary strategies for Leavenworth: to relocate clinical services away from historic portions of the campus of the VAMC Medical Center there, the main hospital, and that gets to that previous recommendation of having an outpatient clinic, a new building. Expand optometry, physical therapy, audiology, and specialty provider services at the St. Joseph, Missouri clinic to become a multi-specialty clinic. We've already moved in that direction, and not just for St. Joseph CBOC, but also to our other clinics which we have. This new Kansas City, Kansas clinic, Lawrence, Junction City, is to expand services there, chiropractic care, and so we're already in progress there. We want to rescope our mission to a low acuity, short stay inpatient medicine services, and to build stronger collaborations with Kansas City VA to support CLC, our community living centers, and outpatient surgical centers. Now we'll shift over to our Topeka campus. Those recommendations are to convert the ED to an urgent care center, establish a strategic collaboration with the academic affiliate to provide inpatient medical and outpatient surgical services within the community of Topeka and discontinue the services here at our VA campus. Establish a new clinic in Iola, Kansas, and we're already have plans and doing some different packaging to be able to get that funding to move forward for that new clinic. And when we do that, then to deactivate the part-time clinics in Chanute, Garnett, and Fort Scott, Kansas. There are complementary clinics within 30 miles of those facilities, especially as we get Iola opening, then we'll definitely have that within our southeast corner of Kansas. Now, we won't deactivate those clinics in Chanute, Garnett, and Fort Scott until we have the new Iola clinic up and running. Some other complementary strategies are expand optometry, physical therapy, audiology, and specialty providers at the Junction City clinic to become a multi-specialty clinic as well. That is our fastest growing area, Manhattan and Junction City. And then to educate and build a strong collaboration with Irwin Army Community Hospital at Fort Riley for the use of the services at the new hospital. And so we're excited to strengthen that relationship as well. Finally, you may be asking, what are the next steps? Well, these are recommendations that the Secretary will give to the Commission, which will then go to, and they will review those recommendations through the end of the year of this year, and in January of next year, we'll give those recommendations, maybe some modifications that they come to. They will give that to the President, who in turn, after his review and his administration reviews that, will give that to Congress next February 2023. And then they will take a look and decide whether they will approve these or modify them. When that occurs, we will be giving more information regarding detailed planning in advance of any recommendations. We'll be getting that more information so that we can plan for that. So the potential changes to our infrastructure are years away. As I've said, we've already started some of these initiatives and clinics because we saw that as we looked at our data and strategically planned. But in some cases, it could be 7 to 10 years away before any of these changes occur, because these are just recommendations now. Secretary McDonough has pledged transparency throughout this multi-year process. He is going to be communicating with us as VA leaders, VA employees, we will be, and he will be communicating with veterans across this great nation. And we're going to continue to be communicating with you through other venues like this Facebook Live, but also when we get back to more face-to-face town hall meetings, we'll be sharing the information that we have with you. I want to let you know that we love serving our veterans. We love serving you here in Eastern Kansas. My team just loves serving you and living that mission. We are grateful that you come to us when you need the health care needs. And now we have an opportunity to be able to take care of your needs within our campuses, within the community as need be. And that will show that we are still remaining here in Topeka and Leavenworth to meet your needs. We know that we need to be here. We know that we need to support each other in the great care that we provide, working with our community as well. So I encourage you, if you haven't received care with us or enrolled, come receive care with us. You will follow with all the other 40,000 veterans who trust us, choose us at a high level, over 90%, and that is one of the best scores across our vision, is you who've given us that, who trust us every day. I want to let you know, once again, that we're providing services. We're not leaving the market. We're going to continue to provide more services as our strategic planning direction goes. Right now, in fact, as I told you, Kansas City, Kansas is opening up a new clinic next week. For those in that area who are receiving care, you're going to love it. And then we are also working with the American Legion in Emporia to stand up an Atlas virtual unit where our veterans there in Emporia can go to the American Legion Hall and can receive services through virtual means right back to Topeka and Leavenworth from our medical providers. So once again, I thank you for all that you do for us. We love serving you and would love to be able to answer any questions. If you put them in the chat box, we'll answer them. Thank you.
So one question from Tanya is, what about veterans who need a longer stay or who are a high-risk veteran who might need something better than isolation?
Great question. So we have a network where we work with our sister hospitals in the VA, in Wichita, Kansas City, Columbia, in fact, across the nation, that as eligible, we can transfer the veterans to those facilities. But we also have available to us our community partners. And with the Mission Act of 2018, allowing our veterans to choose based upon some eligibility, they can receive care in the community. And we have great relationships with our hospitals here in Topeka, also with those in Kansas City, closer to Leavenworth, and a hospital in Leavenworth as well. And so we can provide and coordinate those services and the eligibility that you may have as a veteran if those needs are needed.
Not a question, but a comment. Mike says he drove by the KCK clinic this morning and it's looking good.
Great. I'm excited for that new KCK clinic. You get a chance to see that. We will have an open house, and we're going to showcase that through our social media means because this is what we do. We serve veterans, and that is another way that we get to do that.
No more questions. Just let them know they can continue to populate those questions as they see the video, and we'll get them answered over time.
All right, as you see the video, those who have been live with us, thank you. Those who are going to watch this on a recorded, please keep putting questions within the chat box there, and we'll answer them so that you may have your information that you're seeking. Once again, thanks for joining us today. Have a great day.